All right, we'll go ahead and get going. It's a little bit weird to have people in the room and I'm not facing them. So hi, everybody. So we'll get going here. Hi, my name is Jim Gell. I'm a professor here in interdisciplinary arts and sciences at UW Tacoma, and I'm hosting this event. Hope you'll share this around with folks so that they can come see. We have this seminar series going on every week, Monday, at 12:30, so hopefully you'll join us. We'll also be recording this session and putting it up online. We'll let you know where afterwards if you want to share the folks who couldn't make it. So without further ado, I want to give them plenty of time. I want to introduce our speakers for today. So this seminar series is about regional climate resilience and mitigation, so trying to look at what issues are and how we go about addressing those things. So our first speaker is going to talk about it from the public health standpoint. Shirley Tan is a senior toxicologist for Seattle King County Public Health Department. Her subject matters are in chemical risks facing residents. I'm reading this off of things that I got. She's a PhD biologist in cellular molecular biology, over 17 years of experience in science policy, regulation, and so on. Julie West also works for Public Health Seattle King County. She has a planning focus, and her work is on healthy community planning, integrating health and equity into local and regional planning projects and policies. So thank you all for coming, both of you for coming, and the floor is yours.
All right. Well, thank you. Can you hear me okay?
Yes.
Okay, great. Well, thank you again for having us as part of this seminar. I didn't realize we were the first speakers, so this is kind of exciting. I'm actually excited to call into some of your other speakers too. It looks like a really great seminar session. So thank you again for having us. To really just talk about the work that we've been doing at the Seattle King County Health Department that focuses on climate change and the impacts in our community's health. Focusing on climate change has been an issue we've been trying to work on over the last several years. And today we thought we'd talk a little bit about our journey and so the process. That's what I'll focus on a little bit. And then Shirley will really take a deeper dive into some more recent work and why we're doing that work. So let me, I think although we've obviously all been feeling the urgency of climate change for quite some time, a lot of our efforts have been somewhat limited due to staff capacity, but we do feel the motivation to keep doing this work. And I think the last 2 years with COVID has impacted some of the work we've been able to do, but it also has brought up some interesting and important connections. And so our ongoing plans for climate related work have been somewhat influenced by the COVID work, and we'll try to mention that as we go through. So let me hear. I can continue. Get to the next slide. Oh, there we go. So I wanted to just start with this slide and this quote here and really talk about what's been driving Shirley and myself and many of our colleagues of just the urgency of the issue. And it's obviously, it's an international urgency, a crisis, a national crisis, and a local crisis. And even most recently, the Lancet report came out with some of their new findings, the newest finding. And I think just wanted to read a quote that they said that really, I think, links to what we're experiencing, is that climate change is making existing problems worse as climate-linked events interact with other stressors to threaten lives, undermine population health, and stress our health systems. And some of those examples will come out as we're talking today. And so, hold on, let me figuring out where my button is. There we go. And we are experiencing it here. And I think we all know it, the fires that we're seeing, just as an example, we're seeing the effects here. This picture was taken by a colleague of ours, not this last summer, but the summer before, same place, same time of day. And the thing around climate change locally is that we can feel it, we can see it We can smell it, taste it. All of our senses are being impacted by the climate change that we're experiencing today. These are probably familiar to many of you. These are the types of changes that we're seeing in our Puget Sound region. This comes from our King County Strategic Climate Action Plan. Some of the issues that we're most concerned with in our area around increasing temperatures, ocean changes, and the potential sea level rises, decreased snowpack and how that impacts our water quantity, and also just the extreme events like heavy rainfall and the heat events. And then these show up in how it impacts our health, and the trends of the climate change are producing conditions and exposures that impact our human health in many ways, as shown here. Since an example, as I mentioned earlier, since 2017, we've come to expect the days and even weeks when wildfire smoke descends and driving the air quality index to unhealthy levels. More recently, during the outbreak of the record-breaking heat wave in June, this last summer, our emergency medical service providers saw significant increases in calls because of the heat events. We saw heat-related illnesses and drownings volumes increase, and our emergency medical providers were seeing increased responses to things like cardiac arrest, and we had deaths, unfortunately. And then our personnel staying with the same example, the emergency medical service personnel were experiencing occupational risks and stress and fatigue due to the call volume. And our hospitals were experiencing volumes of emergency department visits that were leading them to crisis levels. All of this as we're continuing to deal with the COVID response. We do know that not everyone is impacted by some of the climate change impacts that we're already seeing and that we'll see in the future, and that some people will be more harmed by these effects than others. We see our younger people, our younger children, our adults, our older adults, pregnant women, people with chronic health conditions, our communities of color that are dealing with other existing environmental exposures, our low-income households, those experiencing homelessness, and those having to work outdoors are just an example of some of those communities. We also know that there are other social, environmental conditions that are impacting people. Things around having access to information, if language is a barrier, access to healthcare if you are impacted, the types of occupations, as I mentioned on the slide before, if you're working outdoors more on hot days or other extreme weather days, where you live, if there are other environmental exposures, your age, living conditions, income, racism, all of these things start to compound and create extreme conditions, more so for some people. So I think King County has really been leading the way to meet these climate-related challenges. King County was an early and national leader in prioritizing a very comprehensive approach to dealing with climate change. And in 2015, a strategic climate action plan was created. And it was during this 2015 development process that public health, our health department, became engaged in this work and provided some guidance. And at that time, we realized we hadn't really created a coordinated approach or really clear on the roles of our health department. And so one of the action items that was in the Strategic Climate Action Plan, this first one, was the commitment for public health to create a document that would outline our role. And so out of that came a document called the Blueprint for Addressing Climate Change in Health. And this really took a look at what are the roles that public health should be taking when it comes to climate change. And so focused on what are the core public health functions, our strategies, and some potential actions to get us started. So move forward. So that was finished in 2018, move forward a couple of years as the county began to update. That first plan, the 2015 Strategic Climate Action Plan, was a 5-year plan. So in 2020, it was starting in 2019, beginning to update that plan. We had a lot of information from developing the blueprint to start including into this next report. And so during that, we began to add in more action items that public health would be committed to doing over the next 5 years. So I want to just take a step back and look at that blueprint and talk a little bit about how that was put together and why. When we first started working on it, we wanted to think about public health's role in working on climate change in our area, in our region. And so wanting to use the opportunity to work on this document as a way to raise some awareness around the health connections to climate change and the local health connections, as well as articulate clearly what those health impacts might look like and who would be impacted by them. And then again, describing some of our key actions. So we underwent a process of working on this. We did a lot of review of literature and reports that were available at that time, national reports, as well as some local reports. There were other health departments who were beginning to do this work in other places, so we reviewed that. But we did try to focus on local. And I think what we really appreciated and realized that there was some local information, and some of that came from some great reports from community organizations. At that time, or just right before we were working on ours, a report came out called Our People, Our Planet, Our Power. It was a report completed after many community discussions led by the Puget Sound Sage and Got Green, and really pulled out like what the community saw as the issues related to climate change and what the needs were. And so we really looked to that report and organizations to help us understand some of the community need. We did do some additional stakeholder engagement, talking with leadership within the health department and the county, as well as other community leaders and community groups, doing some interviews, some surveys, and then came to draft and finalize that report. So the blueprint really is a way that, again, helps to outline what public health role should be. At King County, for King County government, a lot of the county climate work is led out of our Department of Natural Resources and Parks, is in our Metro department, and even our facilities department. And so we really wanted to better understand what is public health, how do we support that ongoing work, as well as creating our own work, and also how do we create, or how do we support the community's work that have already been going on for quite some time. So it was a way for us to really organize ourselves. Another big piece for us is that thinking about how do we combine this idea around climate resilience as well as community resilience, and that they go hand in hand. And if we're helping to build more resilient communities through a lot of the work we do in public health or other government work, that we are actually helping to build that climate resilience over time. These were important principles that we wanted to keep in mind as we were building our blueprint, about how, as a health department and as a county, we are always trying to lead with equity and social justice, and in this case, thinking about environmental justice and how that is and helps us make decisions on where the work should go and who we're working with. Also promoting the idea of health in all policies, and how does health fit into lots of different policy decisions, whether it's very upstream to a lot of the social determinants of health, whether it's around types of jobs that people have and the types of transportation or access to food. So thinking very upstream, big picture about how health is built into this. using systems thinking and thinking about how all of our work is somehow interconnected and that we need to be working together. And then, as I mentioned earlier, just about how do we really engage community in an inclusive and equitable way, and how do we engage community from the early work and how we plan our projects, how we implement our projects, etc. So we came to this following 6 core functions. And these core functions, if you work in public health or you're studying public health, that these are very much similar to other core functions that we all are working on through different types of projects. And so these are based on foundational public health capabilities. And so they serve as a framework for identifying the strategies and actions to help us guide our work. And we really wanted to make sure that we're aligning this work with the broader King County's plan around equity and social justice, as well as the broader county's plans around our strategic climate action plan. And the thought was trying to also think about how do we, over time, begin to integrate climate work into all of our colleagues, all the staff at public health, into the everyday work. What does that look like? What does that mean? And so that was an important piece of this. Keep going. Here's just taking one of those core functions. Actually, I want to go back 1 second. The blueprint, if you, it's on our website, and we can make sure you have the link to it if you haven't already seen it. Each of these core functions has 2 to 3 different strategies underneath it. And then each strategies has a few different action items that we saw when we put this together a few years ago, what we felt were some of the known action items. And I think that right now we're in a process of trying to better understand, like, how do we continue to build a core work around climate and health, and where do we need to start? And some of the work is definitely around the first one, around organizational capacity, and helping, beginning to look at how do we organize ourselves as a whole health department, and so that we're trying to think about how this work builds into everyone. Assessment, surveillance, and research is really beginning to think about how does health data that public health routinely collects, how do we overlap that with some of the environmental data that we see in the environmental exposures and risks, as well as the community experiences that we're seeing, and how do we begin to connect those and almost start to plan better how to do this work. The listen and educate, it's written that way for a purpose. It's really to think about that this is a two-way conversation, and that, it's not public health going out to the community saying, these are the things you need to do to take care of your families. It's really understanding from the community and asking them, what do you need your public health department to do for this work? Partnership building is connected to that. How do we work with community partners to make sure that people have the information that they need or the resources they need? Preparedness and response, that's an ongoing. So we can do lots of planning around climate and health, but we are having events now. We need to be able to respond better now. And so that's a big piece of this. I think we've been very fortunate over the last few years. We've actually had a chance to work with many different groups within the University of Washington system. I think a couple of groups, especially in the Seattle campus, Dr. Tanya Bush-Isaacson and Dr. Nicole Arrett, we work quite a bit with, and not only through some of the students' projects that they help us with gathering research and evaluation materials, but also just being kind of thinkers and thought leaders as we're trying to build our program. Thinking about health indicators, we've been working a little bit with Jeremy Hess and Dr. Jeremy Hess and Dr. Chris Ebi to really think about how do we move this idea of a surveillance system forward. So we've been very fortunate to have some great partners so far at the University of Washington. I just want to give an example of a core function that I mentioned, and an example of some of the strategies. Here's the listen and educate. The idea about collaborating with partners for an ongoing opportunities to share information. So really looking to communities to help us figure out how do we align with work that they're already doing and getting the right messages out, and what is the best way to do the messages, and what are those key messages that would work best with the community groups that they are working with. Here is an example that some colleagues of ours worked on. This is some work from our preparedness team a few years ago, led by Robin Foman, and also working with, again, some of our UW colleagues, professors and students. And this was a few years ago when we had some heat events, extreme heat events, and how do we create something that is more relatable and easy to translate and easy to get information out, and was creating some comics, zines they're called, to around some of the key messages and ways to protect yourself during the heat, and then having that translated and working with community to get that out to their communities. So that's just one example, and Shirley's going to be diving in deeper in another example and when we transfer over. So for our future, we are working to implement, again, as I mentioned, our blueprint, trying to really think a little bit more deeply about each of those core functions and how do we actually implement on a daily basis, not just waiting for an extreme event or heat or a windstorm or a smoke event. How do we prepare and get ready and work with partners to do this? So we're continuing with that. I think I just wanted to, I'll finish my slides real quickly, and just kind of some bottom line things that we are really focused on is that we know what we know, and that today people are being impacted by this, and that there's many different ways that people are being impacted, and that people are not being impacted the same. There's definitely more groups that are disproportionately impacted, and how do we really work to focus on those groups and provide as much support. But what we do know that it is happening today. It's not something that's happening someplace else, so it's going to happen in the future. So we need to be prepared to act now. So with that, I am going to turn it over to you, Shirley.
Thanks, Julie.
You just tell me when you want me to change the slides.
Okay, perfect. Yeah, so thanks, Julie. That was really great. I love watching your talk. I learned something new every time. So it's pretty cool to see how our blueprint evolved. And so I was going to give an example today of what we're doing around climate resilience and public health. And I think one of our most pressing and most recurring examples is wildfire smoke. So next slide. So in the last 3 years, wildfire smoke, we've been working on wildfire smoke for many years, but our department has really ramped up in our response. And so it is now become a year-round preparation, and we're all working on this topic now year-round. So we have our smoke event every summer, or we plan for it whether we have it or not. And it seems to be that we have one more commonly now each summer than we did in the past. So after that, we begin to review the syndromic surveillance data to see what the impacts on health were. We review any new science that's come out in the year, and then we use that information to improve our processes. And then as we head towards the summer, we start to revise our communications and when we're going to put out different communications. And we start seeking funding actually right after the smoke event. We start trying to figure out how we're going to fund the next year's interventions and activities. And then we begin to organize our interventions and do our response planning. And then summer comes and we are hopefully prepared. So next slide, please. So yeah, we generally have 3 main buckets. We're doing some early planning to find funding, plan interventions for communities, and start communicating to communities to get ready and what they need to do to get ready. And then mid-season, we start to distribute our interventions, and I'll talk more about that, and expand our messaging. And then during the smoke, we're releasing advisories. We're potentially opening clean air shelters, and we're giving out recommendations for when to cancel events and what to do. Next slide, please. And in the last couple years in particular, it seems like there's a lot more data coming out since the West in particular is having so many wildfires, and some of the seasons now, for example, in California, seem to be lasting all year long. So there have been some really interesting papers that have come out in the last couple of years. One, for example, is showing that PM 2.5 from smoke may be 10 times more toxic than from other pollution sources. And the risk burden of wildfire in the US is changing. And so in that paper, they looked at how much PM 2.5 is coming from wildfire smoke generally in the region when you look at pollution as a whole. And in some parts of the US, particularly in the West, that amount of PM 2.5 from smoke that's contributing to the overall pollution PM 2.5 can be up to 50% in some places. So it's really definitely having a very big impact on what we're exposed to and the source of that exposure. We're also doing a lot more syndromic surveillance in our own state, and we've improved those methods over the years. And in the last big smoke event we had in 2020, it highlighted risk for heart attacks and stroke. And there was some growing evidence of impacts to young and healthy people too, because we're finding they don't often pay attention to the guidance. They still go out and exercise, and it's actually leading to more health impacts. And now with COVID-19, we're seeing a lot more data come out looking at altered severity and outcomes of COVID-19 infections during smoke events. There's usually a 4-week delay to that between the fire smoke event and then the severity impacts that we've been seeing in the literature. And we're also expecting that long COVID or past COVID infections will increase health risks from wildfire smoke. There's also been some interesting climate change studies looking at areas with high pollution and how they experience greater climate-induced mortality, and smoke is definitely considered in that pollution. And then continued interest is ongoing on impacts and methods to protect people that are living homeless, since their exposures are often 24/7. Next slide. So when it comes to just a quick brief note on wildfire smoke and COVID-19, we do know now that we're seeing some data that populations most impacted by wildfire smoke are now included, including individuals who are most at risk of getting COVID and individuals experiencing lasting impacts from having COVID. And so that is now one of the populations of concern we've added to our list of sensitive groups when we put out risk communications around wildfire smoke. And as I mentioned, there's now studies suggesting wildfire smoke has potential to increase infections and deaths from COVID. And in 2020 and 2021, due to the pandemic, we weren't able to open public clean air shelters. So we really have shifted our focus to clean air rooms in people's individual homes. And this has also coincided with COVID-19 transmission. So the messaging on trying to create clean air in your home applies to both smoke and COVID-19. So next slide. So as I mentioned, we are really always trying to push the message that clean air is important, clean indoor air is important. And wildfire smoke just really makes that message even more important, as does COVID. So a lot of people don't know that because we spend so much time indoors, often indoor air is even more polluted than the outdoor air that we breathe. And some of the immediate impacts of poor indoor air can be irritation to the eyes, nose, and throat, headaches, dizziness, fatigue, and cold or flu-like symptoms. But when you're exposed to poor indoor air quality all the time, chronically, in your home or in your workspace, it can lead to some longer term, more serious impacts such as cancer, respiratory diseases like asthma and COPD, heart disease, and it can make existing health conditions worse. Next slide, please. So when we talk about public health interventions, where do we focus? And I'm going to talk about that now. Next slide. So for wildfire smoke interventions, we know that focusing on who we know is most sensitive is we always include in our messaging the young, babies and children, people over 65 years of age, people with existing health conditions, and pregnant people. But next little, thank you. Oh, next one. But we also know that social determinants of health also considerably define who's most impacted. So you can just go through all. There's multiple stressors that and other chemical exposures. Oops. Thanks. That can exacerbate wildfire smoke impacts. And in that group, we consider people living homeless, people who are experiencing environmental racism, housing condition, burdens faced by the BIPOC community, and communities who are most impacted by climate change. Next slide. So every year we try to kind of put out some early messaging about what you can do during smoke events. And that includes checking for air quality throughout a smoke event, just to know how smoky it is. Limiting your outdoor activity when air is poor, keeping indoor air clean, and you can do this through multiple measures. If you have an HVAC system, you can improve your HVAC system and reduce the amount of outdoor air coming in during smoke, and increase your filtration. You can use a portable air cleaner, like a HEPA air cleaner, or you can use a box fan with a furnace filter attached. And if you have concerns, we always recommend people contact their healthcare providers. Next slide. So for the last couple of years, we've had a lot of, when we're doing our planning on how we work with the community, there's two different buckets that we've been working on trying to help with interventions. One is residents who can't really access clean air very easily in their own homes. And since we have had COVID, we haven't really had clean air shelters very available, but in previous years, we tried to open some clean air shelters. But another avenue is to help them improve their indoor air at home. And then the other bucket is people living homeless. We know that indoor air in congregate settings is often not, those settings are not often the best settings for clean indoor air. And there are very few clean air shelters for people who are living homeless. Next slide. So on the residential front, for the last couple of years, we have been trying to hand out box fan filter kits to communities most impacted by wildfire smoke. And so this is a low cost way to create clean indoor air in your space. So this last year, we provided 700 kits last summer to residents. And then we've been working very closely with Puget Sound Clean Air Agency, and they also provided an additional 700 kits within King County. And we did the distribution through a community partnership model with community-based organizations throughout King County. And all of the organizations were on our King County Climate Equity Task Force. So currently we are doing an evaluation to better understand how that process went and how the intervention worked for different community members. We also are wrapping up right now an air monitor pilot in people's homes in a small population of people who receive box fans. We've put in a little air monitor that indicates when air is good, and as it trends to bad, it shows different colors. And we've tried to give people information on what activities they're doing in their home that may make air quality worse. And during a smoke event, we had a survey that they could fill out to try to understand how the box fan filter kit was helping out. Next slide, please. So these box fan filter kits are really easy to put together. It's just a 20 by 20 by 1 inch furnace filter, and you can see that on the right. And then it's a 20-inch box fan. And then we had some brackets 3D printed, but you can use duct tape or giant bungee cords or rubber bands to attach the filter to the box fan. And then you just make sure the filter's on and that it's in the back, it's on the back of the fan, pointing with the little arrow there in the corner, pointing towards the back of the fan. And you turn it on and it even kind of suctions to the fan a bit. And that works very effectively at filtering the air in your space. Next slide. And we have a little bit of data from PUGET Sound Clean Air. They did some tests to show how effective it is at removing small particles, even ultrafine particles. And most of the time we're just looking at PM 2.5, but it can also remove the really, really tiny particles. It works well in a small to medium sized room. So if your room is around 300 square feet, that works really well for that size room. Within 20 minutes, you can see that the particulate matter really decreases quite a bit. And then the blue line shows that it's pretty comparable to some of the air purifiers that are on the market, the HEPA air purifiers, but the box fan filter kits are quite a bit louder. Next slide, please. So on the other end of our community planning, we're working a lot with communities and shelter providers for people living homeless. So next slide, please. So we know that in congregate shelter spaces, well, for folks that are not even in a congregate shelter space that are living outdoors, smoke exposures can be constant, 24/7. And we know that those that are able to get into a shelter, they may not be in the most optimal building space, because a lot of the shelters we know that we work with are in some of the remaining spaces that exist. They're not, a lot of times they don't have any sort of air filtration or HVAC system. They're kind of just older buildings that are kind of more run down. So air quality, indoor air quality can be a problem anyway without wildfire smoke. And we know also that existing shelters are often very full. There's more need than we can provide. So there's a need for additional options during smoke emergencies. And the smoke impacts on health in this population are really not well understood. There are not many studies in the literature on this. And so it's hard to use data to move the needle on how we're helping the homeless population. Next slide, please. So during COVID in our health department, we were able to obtain 3,000 HEPA air cleaners through COVID funding that we were able to provide to King County shelters. And so we've distributed those, and we now have even more that we're trying to obtain and distribute. And these were really intended for COVID-19 risk reduction, but they also are really helpful for wildfire smoke. And then we were also able to reserve many of them for some emergency sheltering. So during COVID, if we have winter weather emergencies and we need to open a shelter, we can provide HEPA units to that shelter. And same goes for smoke events or cooling shelters during the heat of the summer. But we are expecting, we didn't have too much smoke last year, thankfully, but we are expecting that these HEPA air cleaners will have an impact in these shelters during a smoke event as well. We're still doing an evaluation currently of the shelters that received HEPA units. And we're also doing an air monitoring study with faculty from UW to really understand how they're impacting indoor air quality and what we can be doing better to really improve indoor quality air quality with these HEPA air cleaners. Next slide, please. So we still, though, have a lot of challenges and needs in addressing indoor air quality during smoke events. We know that climate change is ongoing and it's not going anywhere or getting any better anytime soon. So we need to be prepared for that. We know that there's a lack of indoor air standards in the US, which makes it hard to know what we're aiming for when it comes to providing clean indoor air. We have a need for better building codes that provide better air filtration in buildings generally, both residential and business buildings. We need more awareness around indoor air quality, and we need more creative community partnerships where we can work together to try and provide better air to people who don't have access to it. Next slide, please. So that's the end of our talk. And I thought I changed the slide, but I put my email. I had Julie's on there too, but we can get it to you if you need.
Great, thank you very much. Sorry, I'm in the classroom, so masked up with my students. So let me know if you can't hear me very well. Questions? Anybody have questions? If you are virtual, please chat your questions and we'll forward them here. I'll read them out to our speakers. Anybody in the room got questions? Go ahead. We're wondering if you can make these slides available. This is recorded, so you can actually see the whole talk afterwards. So you should be able to see all the slides as well. But so anybody out there, does that work for you? Is that what you mean? Okay. I have a question for you. So you mentioned reaching younger people. So what's your plans or what ideas do you have for messaging to younger people during especially things like smoke events?
That's a really good idea. I think last year was the first year we had that new information from our syndromic surveillance. And because we were in the midst of COVID, we really, we kind of just did the same messaging, but we added that message to our get ready messaging as well as our during smoke event messaging. And then we didn't have much of a smoke event last year, thankfully. But I think it's a good question. I think there are avenues we need to be reaching out to more to get to that population, because traditionally we focused on the really young and the older. So
Gotcha.
I think UW would be a great partner, though, to get some of those messages out.
Yeah, so it sounds like a cool project for students to actually think about how would you message other students when it comes to those sorts of things. So yeah. Awesome. I got a question in the chat.
Add one point to that is part of this, the broader planning of climate for the health department is as we begin to think about how to integrate climate work broadly, we have Shirley and I are both with our environmental health services division, and we really want to find ways to expand this work with more divisions and groups within public health and even within other agencies in King County. And many of our partners in other agencies work with youth and students and other groups. And so trying to figure out how we can kind of build into those programs and use already existing connections is a piece that we want to do. But I'm glad someone asked that question because we often get asked that too. And it's important to figure out how to address this to youth.
And I would also add for the box fan filter distribution work, we're doing a lot of that with Tanya Bush Isaacson, especially the air monitoring evaluation work. And we're also doing the distribution with community-based organizations. And I think there's a lot we could do with the community-based organizations to get the youth message in there as well and out and distributed.
Awesome, thank you. Another question. Tina is wondering if the climate action plan is collaborating across county borders. Are you guys working with other counties?
And I'm wonder if Tina, is you referring to the public health's blueprint? If so, that's because that's our health plan that we're trying to develop. And I think that it's a great question, as climate doesn't have borders, so that's important. I think that one of the reasons I know that Shirley and others like to work with the Puget Sound Clean Air Agency, because that is a broader look at how we do that work. And in other parts of our work, when we look at issues around land use, transportation, we also look across especially the closest 4 counties. As part of our work to implement our blueprint and activities, we are reaching out and talking with some of our nearby health departments, like the Tacoma Pierce County Health Department, and even further afield, to figure out like, what are they working on? Can we begin to try to work together to get a little bit more synergy? But that's a great question and great reminder for us to continue to work together.
And I would also note for this wildfire smoke work, like Julie mentioned, we're working with Puget Sound Clean Air Agency, which is broader. But we also are on the State Department of Health's Wildfire Smoke Advisory Group, which includes folks from all over the state, all the local health jurisdictions. And so we do a lot of cross-departmental, cross-state work with them on developing guidance and messaging and comparing what we're doing.
Awesome. Another question, getting at the idea of, do you also work in kind of the mitigation end of things for climate change, overlapping with other partners that have to do with environmental conservation or restoration to deal with climate change effects?
Yeah, great question. And from a process perspective, I just want to mention we've done a lot of talking to different public health, our different division directors and public health directors, and we get the same question or the same hope that we need to be working on both sides of adaptation and mitigation. And so, great question. And a lot of as I mentioned, public health is part of our blueprint is a response to the broader King County work around climate change. And so we have partners within our King County Department of Natural Resources and Parks who have lots of action items that they're working on. Our Metro Transportation Group, again, the same thing. And so part of our role is like, how do we support that work? What is it that they need to help not only in their decision-making of like, where do they spend their efforts or where do they spend their resources and time? Is it looking at where we see greater health impacts from lots of environmental exposures? As we mentioned in the beginning, we're seeing climate as this idea of this threat multiplier, that we're seeing a lot of the same environmental exposures and impacts happening in the same communities, and then the resultant health outcomes. And those are the types of information that we can help share with our partners who are working in some of these other areas, as well as really supporting the inclusion of community, because there are a lot of community organizations are working and trying to do some of these same types of things in community. So how does King County support that work? And then specifically, how does public health support that?
All right, thank you very much. I think we are out of time before another class comes in and kicks me out of the room. Thank you all. Thank you both very much. That was an awesome talk and a great kickoff to this series. As I said before, this will be available recorded not too long from now, and I'll send out the link to where to find those things. And it sounds like some amazing work that you're doing, and we'd love to, if you can think of anything that we down here at UW in Tacoma can collaborate on, it would be wonderful to get our students and faculty involved as well. So thank you all. It's great to see you, and we will talk to you soon. Take care, everybody.
Thank you.
Bye.
Bye-bye.